Hi, I'm Richard Santucci. I'm a senior surgeon at the Crane Center for Transgender Surgery. Sometimes when we approach your insurance company for approvals for surgery, there can be a denial. One of the things that we do for you at the Crane Center is we approach the insurance company requesting that the denial be reviewed. This happens in a so-called peer-to-peer conversation between two physicians, and it's something that we spend a significant amount of time on for you every week. Testis prostheses, which is a operation where artificial testicles are placed within the scrotum sometime between 6 and 9 months after an original medoidioplasty or phalloplasty, can sometimes be rejected by insurance. This is because the insurance is actually thinking of a different use of testicular prostheses, period. While many insurance companies cover, some will not replace a single testicle lost to disease or cancer or injury in a cis male who has one remaining testicle. They deem that to be cosmetic, and it's not a covered benefit. However, if that rule is misapplied to a patient having genital gender confirmation surgery, then you can get an unfair, incorrect rejection of the claim. So the problem is that these are not the same things, and placement of testicular prostheses in a transgender patient is a medically necessary treatment for gender dysphoria. We've already agreed in these patients that they have severe persistent gender dysphoria and agreed that they're eligible for medoidioplasty or phalloplasty surgery. So it's only correct that we continue that agreement in subsequent stages of the operation. Placement of testicular prostheses is really just part of the staging of the already agreed upon gender reassignment surgery. I can say that while this is an often rejected benefit, that after a conversation with the peer-to-peer physician at the insurance company, we often are able to get them to see our point of view, and they do cover. In those unusual cases where they simply dig in and refuse to cover, we can help you arrange a cash pay price so that the surgery can move forward. So let's talk about the surgery. So in this surgery, generally 2 small incisions are made in the upper scrotum, and a space is made inside the scrotum to place the testicular implant. We work very hard to get that implant as far down in the scrotum as possible, and then that's sewn up. Sometimes this happens together with other surgeries. So for example, in a second stage medoidioplasty, I have to do some operating in the upper part of the scrotum anyway, so I'll use those same incisions to place the testicular implants. We often place testicular implants at the same time as a penile prosthesis in phalloplasty patients. And in that case, either a small incision will be made in the upper scrotum, or at times I can actually get the implant in the right place from our lower abdominal incision used to place the penile prosthesis. After placing the testicle prostheses, when your skin is sewn up, a special biological glue is generally placed, and that means that you can take a shower immediately and don't need to do any special wound care like Neosporin or Polysporin on top of that, because it's got that barrier of glue over the top. Generally, testicular implants have a low complication rate, but the biggest risk is that of infection. We do a lot to fight infection during this procedure. You're going to be given very strong antibiotics before the procedure. your skin is not only prepped sterilely as we would for any surgery, but actually extra sterile preps are applied. We never touch the prosthesis itself with anything but freshly placed sterile gloves. We soak the prosthesis in high-strength antibiotics, and believe it or not, the prosthesis will absorb those antibiotics, and then over the next week will kind of elute or leak out those antibiotics, further decreasing the chance of infection. We wash out the wounds during surgery with special antibiotic irrigation. We really do a lot. And that means that the risk of infection is quite low, maybe 2 or 3%. In the case of an infection, rarely we can give you oral antibiotics and it'll just get better, but often the testicle has to be removed. If we have to remove the testicle, the good news is that we wait 6 months, let everything calm down. Generally, we can replace the testicle at a later time with good results. The other problem of this procedure is the scrotum itself. Your scrotum was carefully made from 2 flaps of former labia majora. These were freed up and then sort of origamied up to make a scrotum. And your scrotum is probably doing fine, but it may not like the surgery that we have to do to create a space for the testicle. And in that case, maybe the edges of that flap don't survive. That can be a small problem, which is a scab or a little bit of skin loss. But if the skin loss is full thickness, then what can happen is that you can actually expose the testicle, and the testicle then needs to be removed. I will say that after the procedure, when you get to the point where things aren't too swollen or painful down there, I will ask you to kind of grab at the top of the testicle and kind of move it downward. Really, the testicle is in this space in the scrotum, and ultimately it will scar in and stick to one spot or the other, and we'd prefer that it sticks to the lowest point possible. You can have testicle implants with other procedures, so you can discuss that with your surgeon and see if some of the other procedures you may want done are appropriate. I will give you a little bonus track on the idea of the timing of testicular prosthesis. If you are a phalloplasty patient and you're having another surgery, say a liposuction, it may be reasonable to also place testicular prostheses at that same time, even though you know you're later going to have a phalloplasty. Well, why is that? Correction, even though later you know you're going to have a penile prosthesis. Well, the reason for that is that we can then get any possible complications off the table here, and then we couldn't possibly have that complication here when we actually do the penile prosthesis. In that case, we would put 2 testicular prostheses in, and if we give you an inflatable penile prosthesis, then one of them will be removed and the inflation balloon will be replaced into the scrotum. But this just makes it for an easier, less complicated surgery later. I have a second bonus track for you, and that discusses the size of the testicular prostheses. Basically, there are 3 sizes. Think of them as small, medium, and large. Really, nobody gets large. They're really too large. You also don't want us to put too large of a prosthesis in. If we cram, for lack of a better word, too big a prosthesis in there, then it's at risk from sort of shooting out of there and winding up in your groin, or at risk of stretching the skin so much that the skin blood supply is compromised, which can cause big problems, as I've mentioned before. So most everyone gets either the smallest size or a medium size. If you're concerned about getting the maximum size in your scrotum as possible, I would suggest the following. The best plan for this is probably to get 2 testicular prostheses placed in and then wait. Over the course of a year, those prostheses sort of act as mini tissue expanders, and the testis pulling down on the scrotum every single day of your life will make the scrotum a little bit fuller and longer and larger. And then at that year point, if you really feel that you do better with larger prostheses, then the prostheses can be upsized to the next size. That takes a little bit of time, but it's a very safe and reasonable way to get a larger scrotum if that's what you desire. The good news about testicular prostheses is while it is sometimes rejected initially by insurance, usually it will be allowed after a peer-to-peer conversation. In those rare cases where the company refuses to budge, then a reasonable cash pay price can be worked out for you and we can get the surgery done for you in any case.